Welcome. I am Terry Tropin, and today I'm presenting a lesson on ICD-10-CM coding for pathological and traumatic fractures. Let me start with information about myself. I have a master's degree in healthcare administration informatics from the University of Maryland Global Campus and have RHIA and CCSP certifications. Also, I am an AHIMA-approved ICD-10 trainer. I have taught health information technology at Montgomery College in Maryland for over 20 years. I've also written books on coding. These books are study guides that summarize the coding guidelines. My books include one on E&M coding, ICD-10-CM coding, ICD-10-PCS coding, and external causes. These are available on Amazon. Fracture coding. Fractures may be due to an injury, an outside force, or a disease. So something outside the body is an injury, something within the body is pathological. Fractures due to injuries may be a result of such things as falling down the stairs or slipping on ice. The correct code is determined by the location of the fracture, which bone. In the alphabetic index, find fracture traumatic. These codes are found in Chapter 19, the injury chapter in the ICD-10-CM book. On the other hand, fractures due to disease may be the result of a neoplasm, osteoporosis, or other diseases that weaken the bone. The correct code is determined by the disease, then the location, which bone. In the alphabetic index, find fracture pathological. These codes are found in Chapter 13, the musculoskeletal system. First, let's talk about fractures due to injury. These codes have all these possible seventh digits. Not all codes will have all possible seventh digits. Digits A, B, and C are used for the initial encounter. That's when the patient is receiving active treatment for the fracture. It is still considered active treatment if the patient did not come in to see a physician right away, but is seeing the physician for the first time after the injury. The patient also may have been transferred from one provider to another, so the physician is seeing this patient for the first time. The difference between A, B, and C is whether the fracture is open, closed, or a specific type of fracture. Digits D through R are for subsequent encounters. The active treatment is completed and the patient is being monitored during the healing or recovering process. The difference between these digits is whether the fracture is open or closed, the type of fracture, just like the digits for the initial encounter. However, these digits also indicate the healing status. Is it routine healing? Everything's going fine. Is it delayed healing? Or is there a diagnosis of nonunion or malunion? Finally, digit S is used for sequelae. The fracture has healed, but there are complications. Examples are contractures, instability of a joint, or pain. Note that the same code is used throughout treatment, from the first visit through the healing process and, if appropriate, the sequelae. The only part that changes is the seventh digit. First of all, let's talk about open or closed. The codes for the initial and the subsequent encounters include seventh digits to indicate opened or closed. In an open fracture, the bone penetrates the skin, can be seen outside the skin. See that here. In a closed fracture, the bone does not penetrate the skin. The skin is intact. As you can see, here's the fracture, but it's not going through the skin. Seventh digits K through R are used for subsequent care in cases of malunion or nonunion. Malunion is the fracture was treated, but the bone ends did not line up quite correctly during the healing process. You can see here that the bones are a little off. Nonunion is when the fracture pieces do not align at all. Most categories of injury use one set of the 7th digit for all codes within that category. For example, for fracture of ribs, sternum, and thoracic spine, and lumbar spine and pelvis, that's S22 and S32, all of the codes in those categories use these digits, A, B, D, C, G, K, and S. Another example is the S62 and S92, wrist and hand, foot and toe, include all of the codes within these categories use A, B, D, G, K, P, S. Now this one has a digit P for malunion that was not included in the ones up here. So this one includes one more digit than these do. Some categories use various 7th digits for code within the category. So you may have a set of digits and then somewhere in there within that category, the table of digits changes. Some categories use all those, other categories have more than one set. The different digits within a category are for torus fractures, or greenstick fractures, or physeal fractures, or other and unspecified fractures. The categories indicate the location of the fracture, and these indicate the torus fractures, greenstick, physeal, other specified, give a little bit more information. So let's define our terms. A torus fracture is one in which the bone bends but does not quite break completely. In the alphabetic index, find fracture, traumatic, and then the location of the fracture. The fact that it's a torus fracture is indicated in the 5th digit. A greenstick fracture is one in which the bone is broken only on one side. Again, in the alphabetic index, find fracture, traumatic, and then the location, which bone is broken. The fact that it's a greenstick will be indicated in the 7th digit. In the 5th digit, sorry. A physeal fracture involves the growth plate of the bone. In a child, the bone doesn't grow from here, it grows from here. So this is a fracture of that very important growth plate. There are special guidelines for physeal fractures. The guidelines state you list a code for physeal only. Do not also code for the location of the fracture. In the alphabetic index, find fracture, traumatic, location of the fracture, then physeal. So here's an example. Physeal fracture, femur, lower end, condyle. S72.41 with an appropriate 7th digit. So you're going to code only S79.4.10, fracture, traumatic, femur, lower end, physeal, not codes S72.41. So this, you're not going to use this one. You're going to use this one. So what this is saying is that the fact that it's a physeal fracture takes precedence over the more specific location. You'll see that 4.1 says condyle. This one doesn't say condyle, but nevertheless, you're going to use this one. Let's look at some other categories that have more than one set of 7th digit. S12 is one of those. For fractures for specific vertebrae, they use the 7th digit ABDGKS. For other and unspecified parts of the neck, it uses only ADS. So for the other and unspecified parts, it excludes the digit B for the initial encounter open fracture, no digit G for subsequent encounter with delayed healing, and no digit K for subsequent encounter with nonunion. So for these codes, you can only use these. You can't use the BGK. Fracture of shoulder and upper arm is category S42. And this uses the 7th digits ABDGKPS for most codes. For the clavicle, scapula, and parts of the humerus. Codes S42.27, S42.48, which are torus fractures, and S42.31 greenstick, it uses ADG-KPS with no digit for initial encounter, the B. So the problem with this is that the difference codes are kind of in the middle. So you start with S42.0, S42.26, and that has ABDG-KPS. Then you go to S27, and that uses ADG-KPS, and then you go back on S42.29 to the ABDG-KPS. So that's why this is confusing. That's why I'm spending time with this, because you start with one set, you go to another set, and then you go back to the first set. So it's very confusing. So for other and unspecified injuries of the shoulder and upper arm, some of these are for physeal fractures. In that case, S49 says ADG-KPS. These are for physeal fractures. The other codes in this category, S49, use different digits, but these are codes for other injuries, not fractures. So we won't talk about those at this point. Fracture of the forearm, as S52, uses 7th digits A through S for most codes. But for torus fractures and greenstick fractures, it uses only ADG-KPS. So the digits in here that are for open fractures are not used for torus and greenstick. Fractures of elbow and forearm include codes for physeal fracture of the ulna and radius with 7th digits ADG-KPS. Other codes in this category are for other injuries. They have different 7th digits, but those are not for fractures. Those are for other injuries. Fracture of femur. Most codes in category S72 include 7th digits A through S. However, the torus fractures use only ADG-KPS, no digits for open fractures. And then it goes back to S7249 and picks up those 7th digits from here. Fracture of lower leg, including ankle, so it's with S82, includes the digits A through S. However, the torus fractures, ADG-KPS, no digits for open fractures, and no digits for those different kinds of fractures like type 1, type 3A, etc., that are a part of these digits. So other injuries of ankle and foot includes codes for physeal fractures of parts of the foot. These codes include ABD, GKP, and S. Other codes in this category are for other specified and unspecified injuries, not including fractures, and they have different 7th digits. So let's look at the summary of the guidelines for coding traumatic fractures. So if a fracture is not documented as open or closed, list a code for closed. If the fracture is not documented as displaced or non-displaced, use a code for displaced. So we're assuming closed, we're assuming displaced. Physeal fractures, we mentioned earlier, the area of the cartilage at the end of the bone where long bones of children experience growth. And again, we said list a code for physeal, not a separate code for specific bone fracture. If the fracture was not previously treated, the patient is now seen with fracture or malunion. So the patient waited before coming in. They, it's going to be all right, it just hurts a little bit. And then they come in and they go, well, you've got a fracture. This is still considered the initial encounter because it's the first time the patient sought treatment. If the fracture was previously received active treatment and then the patient returns with a complication such as malunion or nonunion, you're going to use one of those subsequent care KMN or PQR 7th digits. Remember, throughout all of this, you're using the same code indicating fracture and the location. The only thing that's changing throughout the treatment is that 7th digit. If the patient has multiple fractures, list first the most severe fracture and then other fractures. So you're going to list a code for all of the fractures because they all have to be treated to some extent, but the most severe one is listed first. A fracture documented as open but not type of fracture 1, 2, 3A, whatever. It's not specified. Use the 7th digit for type 1 or type 2. And not all fracture codes have type 1, type 2, whatever. But if they do, if that's a possibility, but it's not documented, you're going to use type 1 or type 2. So you're assuming it's type 1 or type 2. Okay, let's do a practice. If you wish, turn off the video and try to code this yourself, then turn to the video back on to check how you did. Open skull fracture. This is coded as SO2.91XB. In the alphabetic index, you find fracture traumatic. The specific site of the skull fracture is not stated, so it's SO2.9. The 7th character B is assigned to indicate the fracture is open, and this is the initial encounter. Okay, let's move on to pathological fractures, fractures caused by disease. These are in the musculoskeletal system chapter. In the alphabetic index, find fractures pathological due to, or fractures pathological and then the specific bone involved. Code first for the disease and then the location of the fracture. So you're going to look up pathological fractures and then the disease and then the location. These are much simpler. All you have is M80 and M84. Okay, M80 is osteoporosis. M84 is disorders of continuity of bone, and that's fractures. Here are the possible 7th digits. Boy, this looks a lot easier, a lot more straightforward, doesn't it? These are the only ones you have. They don't have digits for open fracture or closed fracture. And the digits don't change depending on the code, the subcategory. You don't have those table and then another table and then another table within the same category. So you have active treatment, which is an A, subsequent encounter, just D, G, K, and P, routine, delayed, nonunion, malunion, and then sequelae S, healed with a complication. So much easier, many fewer digits. So let's define some terms. A stress fracture includes tiny cracks in a bone. It is due to repetitive force, such as a runner training for a marathon. What's interesting is in the index, stress fractures are under the main term fracture traumatic. However, the codes themselves are in the musculoskeletal system under M84. So this is kind of confusing also. Atypical femoral fracture is a complication of long-term use of drugs, bisphosphonates, which are prescribed for treatment of conditions such as osteoporosis. This is in category M84.7. So fractures due to osteoporosis, that's M80. If it's osteoporosis, patient has osteoporosis and there's a current at this time pathological fracture, you're going to use a code from M80. If there's no fracture at this time, you're going to do M81. So it depends. Knowing the patient has osteoporosis is not enough. You know, is there a fracture right now or is there not a fracture right now? So it's M80 or M81. If appropriate, you can also use a history of osteoporotic fracture, which is Z87.310. So here's a practice. Again, shut off the video if you'd like and try coding this yourself. Aftercare for pathological fracture of L4 vertebrae, routine healing. So this is documented as pathological, but the underlying cause is not specified. So turn it off and see what you come up with. So the answer is M84.48XD. In the alphabetic index, find fracture pathological vertebra, which refers you to M84.48. In the tabular list, you see you need to add the placeholder X and 7th digit D to indicate routine healing. Don't forget these final digits. If it doesn't have all the digits, the code is incorrect. Also note that if you went to fracture traumatic, you'll come up with an S12 code, and that's incorrect because this is a pathological fracture, not a traumatic fracture. So it's also possible the fracture is due to a neoplasm. The bone is weakened and normal activity may result in a fracture because the patient has a neoplasm. So you're going to use two codes. You're going to use the code from subcategory M84.5 for the fracture and a code for the neoplasm. Now, which one is listed first? You know, that's very important in ICD-10 coding. The answer is it depends. Is the visit focused on the fracture or is the visit focused on the neoplasm? You can also list Z87.311, history of pathological fracture, if that is appropriate, if that is documented. So make sure you have marking up your book. You can't possibly remember all of the guidelines. It's just not possible. So write things in your book. You don't want to be in the middle of taking a test or certification exam and saying, you can see, I know there's a guideline for that. What was that? You want to have it all written in your book as much as possible. So make sure in the alphabetic index you differentiated between pathological and traumatic fractures. You can highlight, you can circle, whatever works for you. Now, in the tabular list, you want to make notes for those categories where more than one possible 7th digit. And here's a list of those. That's 12, 42, 49, 52, 59, 72, 82, 99. You also want to circle the note, use additional code under M84.3, M84.5, M84.6. It's in your book, but it's so easy to miss it that I think it's helpful to draw a circle around it. You might also want to write in the definitions of the types of fractures, maybe at the beginning of the musculoskeletal system: stress fracture, torus fracture, atypical femoral, and greenstick fracture. That completes this lesson. If you have questions or comments, please feel free to contact me. I would love to hear from you. If you would like a hard copy of these slides, just ask. Here are the books, and here's how to contact me here. And here are the books that I have on Amazon. I have a PCS book, a CM book, an external cause book, and an E&M code. These are all available on Amazon. Here's the link to it, or you can just go on Amazon Books and type in my last name, Tropin, T-R-O-P-I-N. Thank you so much for listening. I hope to have more lessons up soon. If you have something that you would love for me to talk about, just send me a note and I will pay attention to it. I want to do what people think they need done. Thank you again.